Hello, welcome back. Today we are looking at physiotherapy in laparatomy. Last time we were looking at physiotherapy in post-surgery, in thoracic surgeries. So we are making progress. We are looking at laparatomy, physiotherapy in laparatomy and mastectomies. Okay, so we are still looking at surgery, physiotherapy in surgery. So you find that there are different types of surgeries, those that affect the chest wall are the ones we talked about earlier on. And now we talk about those that will affect the abdomen and those that affect the breast tissue. All of these are tissues that are going to affect the cardiopulmonary function. So we are concerned with them in cardiopulmonary so that we understand how we are going to deal with these conditions and these presentations as physiotherapists. Okay, so abdominal surgeries include any type of surgery that involves opening of the abdominal area. The main types of abdominal surgery include the surgery known as laparatomy, or the procedure known as laparatomy. Okay, laparotomy is the opening of the abdominal cavity during surgery to identify any bleeding or damage in the area. So anything that happens, remember, anything that is happening to these tissues, it is going past the muscles. And once it goes past the muscles, it is affecting the musculoskeletal tissue, which is our baby as physiotherapists. This is our main area of concern. So we have to understand them. Surgery can therefore involve any of the organs that include the stomach, the liver, gallbladder, and anything that is contained in the stomach and involves opening of the abdominal cavity, including conditions such as appendicectomy. Okay, this can go for surgery when an appendix is maybe inflamed or it has to be removed. Okay, in a condition known as appendicitis, the abdominal cavity is opened and the appendix is removed in what is known as appendectomy. Okay, in the condition known as appendectomy, it is removed. Or laparoscopy can be done, which is a type of surgery which is minimally invasive and with a small incision and is made into the abdomen so that for explorative purposes, so that they explore the problematic areas of the abdomen. Cholecystectomy, which is the removal of the gallbladder, can also be done by laparoscopic surgery. Okay, bowel resection, which is removal of part of the bowel, can also be done, and the abdominal cavity will be operated on. Physiotherapy is important both pre-operative and post-operative. So in pre-operative, in abdominal surgery may be elective, meaning it can be planned, which gives you time for you to prepare the patient and make sure that you prepare the patient for the operation and make full assessments. Okay, but it can also be an emergency where you don't have that luxury of preparing the patient and discussing with the patient about the surgery. However, the cause, it is still supposed to be managed accordingly. Okay. Physiotherapy at this stage, at preoperative stage, may include advice on what the operation will involve, pain control modalities. The pain will be well controlled if the patient knows about it and how it should be handled beforehand, before the operation. Gentle abdominal strengthening exercises to keep the abdominal muscles strong, okay, for the operation. Cardiovascular activities can also be done. As you are trying to prepare a patient, you want your cardiovascular system, their cardiovascular system to be strong so that it can overcome the shocks of the operation. Okay, upper limb exercises, lower limb exercise, strengthening exercises. So you need them to be strong and just to maintain their fitness. The levels of fitness should be maintained or even higher, so that even as they come from the surgery, it is not well deteriorated to the point where they may find it difficult to recover. preparation for rehabilitation program after surgery can also be thought of, can be considered amongst the major things. Symptoms of abdominal surgery would be temporary pain, a scar, okay? There could be some kind of paralysis of the bowel, risk of infection, swelling around the incision, and all those are things that you expect. Therefore, physiotherapy after the surgery is important, and patient will be hospitalized for about a week, depending on the symptom and depending on the type of operation that they underwent. That determines the duration that they are going to be hospitalized. Okay, it is important that to commence physiotherapy program immediately after the operation for the best results. Since you have prepared them pre-operatively, immediately after after surgery is done, you commence physiotherapy in the first week. Okay, physiotherapy will concentrate on alleviating the symptoms of surgery and preparing the patient for discharge. That is what we want. They are hospitalized, and amongst the things that they are complaining about is pain. So you institute pain control modalities where you may use ice to control the pain, exercises to move the pelvis. So you do gentle exercises, advice on how to get in and out of the bed, weight transfers in and out of the chair, from the mat on the chair, mat on the chair to the bed, and vice versa. How to access other ADLs. You concentrate on how they are supposed to do other ADLs. You are training them how to cough also, how they are supposed to support their incision area when they are coughing, so that to minimize pain. After they have been discharged, physiotherapy will move on. You are progressing. Okay, you have dealt with pain and other ADLs. Now you are after they are discharged, you are moving on. They know how to transfer their weight. You are progressing to transverse abdominal strengthening exercises. Okay, advice on moving and lifting techniques. Pain control modalities as necessary. Return to cardiovascular activity. In all these things, cardiovascular has to be in good function so that they can achieve the most out of it. By week 5 going onwards, patient should now feel able to return to their normal daily activities. Therefore, physiotherapy program will now be tailored towards more functional activities and work on getting back to full fitness. Okay. At this point, your aim will be to progress, okay, will be to progress all of the previous exercises and to increase the amount of patient is working and other activities. Okay, so what we're trying to say is you increase on whatever you have started. You build on whatever you have started. You progress. You make progress from the areas that you train them, lifting techniques and all those. Lifting light loads can be done after 6 weeks, and lifting heavier loads is not advisable until 12 weeks following abdominal surgery. So you progress in that order from 5 weeks going onwards. Okay. Mastectomy also call for some surgery. Okay, it calls for surgery which affects the chest wall, which eventually affects the cardiopulmonary system. Mastectomy is breast cancer surgery that removes the entire breast. A mastectomy must be done, okay, when a woman cannot be treated with breast conserving surgery, which is lumpectomy, which saves most of the breast. So depending on the cause, either if a lumpectomy is done, even better, but if not, depending on the type of condition they have, a mastectomy must be done. So when it is done, it also affects the muscles, and the musculoskeletal system is involved. So let's look at the types of mastectomies that we expect. Number one, there is what is known as a total mastectomy or simple. This involves the surgeon removing the entire breast but leaving the muscles under the breast and the lymph nodes in place. Then double mastectomy involves the surgeon removing both breasts, usually as a preventive measure if genetic features indicate high risk of breast cancer. So this is how they will present. We can see on the diagram here, both breasts are gone for that reason. Then there's what is known as radical mastectomy, which involves the surgeon removing the entire breast and underarm lymph nodes and the chest wall muscles. So all these are necessary according to the presentation of the condition. If the spread has gone that much, that is, if the type of mastectomy one undergoes corresponds to the amount of spread that the cancer has gone. So if it is spread that much, this person may undergo radical mastectomy. And if you look at radical mastectomy from the pictures here, all this part is gone, okay? The entire breast, the entire lymph node, the underarm, lymph nodes, and the chest or muscles are gone. From the picture here, we can see that almost everything is gone. So we expect a lot of musculoskeletal deficits to present in such a patient. Modified radical mastectomies can also be done, which involves the surgeon removing the entire breast and underarm lymph nodes, but leaving the chest or muscles intact. Remember, radical, even the chest or muscles were gone, but this in the modified one, some chest or muscles would remain. So there at least it gives you a better starting point. Alternative mastectomies are also done, which are referred to as skin sparing. Amongst them are those referred to as skin sparing mastectomies, which involve the surgeon removing the breast tissue and nipple, but leaving the skin intact. Okay. A surgeon also reconstructs the breast during this procedure so that at least there is some breast that is that remains. Nipple sparing mastectomy is relatively new and involves leaving the skin, nipple, and peripheral breast tissue intact. Skin versus nipple sparing mastectomy. So this is what happens in pre-op nipple sparing mastectomy. Okay, then once it is removed, it shows like that, which is here in color, and at least the nipple is spared rather than removing everything. Okay, it's still spared there. Breast conserving surgeries are also there. They are less invasive procedures, non-collectively as breast conserving surgery, and they are now an option for many people with a diagnosis of breast cancer. Okay, examples of these breast conserving surgeries include procedures such as lumpectomy, which involves the surgeon removing a tumor and the surrounding tissue, but leaving the breast generally intact. So this is what we are talking about. So if a tumor is here, the tumor is removed plus the surrounding tissue, and at least the person is just going to have a scar where the tumor was. So this is referred to as lumpectomy or partial mastectomy in some other literatures. Then there is what is known as quadrantectomy. Okay, this is a partial mastectomy which involves removing the more breast tissue than in a lumpectomy, but the surgeon still leaves most of the breast tissue intact. Okay, this is just where a lump is removed and more tissue also is eaten as compared to lumpectomy. So lumpectomy, if a tissue was gotten from there and the lump is there, the tissue from there, this one will get a bigger tissue. This is what is referred to as quadrantectomy. Therefore, the aim of physiotherapy is to reduce after surgery limitations of shoulder range, regain and maintain abdominal movement in the arms and shoulders, reduce pain in the chest wall, keep the muscles strong, and improve overall well-being. That is what you want to achieve. So you make sure that everything that would make you achieve those aims is instituted. Okay? So as a physiotherapist, what are you supposed to do? Begin exercises the day after surgery. Plan to take pain medication 20 to 30 minutes before doing your exercises. Do the exercises at least 3 times a day, every day, until you have regained full range, until the patient has regained full range of motion. Okay, in their arms. So those are the instructions that you are going to give, and that follow with the aims that you have already set up as a physiotherapist. And amongst the exercises that you are going to give the patients are exercises such as this one, okay, which is known as pump it up exercises, where the patient is put, lays comfortably like that. Then this exercises will lies comfortably like that with a pillow as shown in the diagram. Then they start doing this type of exercises with the instructions below. This procedure or this exercise helps reduce swelling after surgery by using muscles as a pump. Okay, you use muscles as the pump. The patient will use their muscles as a pump to improve the circulation in the affected arm on the same side of the surgery. So you give them those instructions, demonstrate and show them those instructions. Your aim is to make sure that the shoulders are mobilized. Okay, you give them these other exercises which where they make sure that circles. It's very important. This exercise can be done in sitting or standing. It's good warm-up exercise and can help relieve tension in the shoulders. Arm lifts are very important. This exercise can be done in sitting, standing, and it helps to improve shoulder movement. Remember, they are affecting the chest wall, and one of the bigger joints that we want to preserve in this region is the shoulder. So once it is frozen, a lot of ADLs are affected. So all of this can be done so that the patient can regain that strength. This exercise, known as shoulder blade squeezing, can be done also in a position that the patient is comfortable with, and it helps to stretch the chest muscles. Okay, so you can also progress. Okay, you progress to stage 2, exercises to do after the drains have been removed. You can give the patient a wand so that they do these exercises as seen here in what is known as a wand exercise. A broomstick, like a broomstick, a stick, and do these exercises so that they are able to mobilize the shoulder. Okay, they can stand against the door and move the hand from there to touch the top of the shoulder so that they can mobilize. So all these exercises can be done to mobilize or to increase range of motion of the shoulder. Okay, not that it may take up to 6 to 8 weeks to regain full movement in the arm. So some patience is required both from you and your client. It is important to continue with rock climbing exercises and the corner stretch exercises throughout the radiation and the undergoing radiation. Remember, most of these are caused by cancers. It is recommended to do a set of these exercises before and after radiation each day to maintain shoulder movement and to prevent side effects such as radiation and radiation-induced fibrosis. Okay. All right. Thank you so much for listening. We'll see you in the next presentation.